Well, hello everyone. Welcome to our very first FSMA Friday webinar of 2025. My name is Jim Albright, and today, as we peer into what this new year might hold, our expert speaker will be guiding us through various regulatory updates from FSMA 204 to what we might expect as FDA leadership changes under this new administration. So, lots to cover today. But before we begin, for those of you who are new to this series, FISMA Friday began well over a decade ago when the Acheson Group, who's a global leader in food safety and compliance consulting services, partnered up with Safety Chain, the developers of a platform that helps food and beverage manufacturers digitize processes and get real-time visibility into plant-wide data. Now, the series is designed to provide updates, insights, and guidance around changes within the Food Safety Modernization Act. And this is your chance to not only learn about methodologies or tools that can help you consistently meet FSMA requirements, but it's your chance to get some of your questions answered. All right, let's breeze through some quick housekeeping items. We have muted all attendee mics, but are leaving room at the end for Q&A. So please put your questions and comments into the Q&A panel at any time during the course of the presentation, and we're going to do our very best to get through them all if time permits. However, if we do run out of time and you didn't get your question answered, do not worry. Our presenter already agreed that we would follow up with you after the presentation. So please send your questions in. And yes, of course, this presentation is being recorded, and we will be sending a link to the recording as well as today's slides following this session. Okay, now I am excited to have back with us Dr. Ben Miller. Ben is the Executive Vice President of Regulatory and Scientific Affairs over at the Acheson Group, and he has over 25 years within the food safety and regulatory space. Now, his previous experience includes having been an epidemiologist and then later developing legislative reforms related to food safety for the Minnesota Department of Agriculture. Now, I have to say this. Ben also holds the record for the most registrants on a FSMA Friday webinar when he chatted with us last year on the finalized Food Traceability Rule. So, Ben, welcome back.
Jim, great to be with you, and good to be with everybody on the webinar today. Happy 2025.
Happy 2025.
It's off to a strong start, I'd say. So,
Yes.
which we will chat about here. But yeah, no, I appreciate the introduction. I've been with the Acheson Group about 6.5 years of TAG's 10-year existence, and I know, as you mentioned, this has been a long-running series, and I think our CEO, Dr. David Acheson, who was at FDA when FSMA was being put together, was a long-time presenter on this series. But good to be with you, and I know we've got a lot to talk about today.
You bet. All right, we have some FSMA updates. Let's dive in.
Nice. Yeah, so I think some of the things that we're going to cover today is just what we're seeing around FSMA 204, which is the traceability rule. Talk a little bit about IAVA inspections, some about the Chevron and Loper-Bright decision. Well, Chevron's the old case. Loper-Bright's the one that sort of overturned some aspects of Chevron last year. And then just predictions on leadership changes, regulatory priorities for the coming year at FDA. So with that, why don't we dive right in and we can chat FSMA 204. So one of the things when we're talking about traceability, this is a rule that got published back in November of 2022, and the FDA gave the food industry 3 years to comply. Current compliance date is January 20th, 2026. So really, this whole rule is about reconstructing the supply chain retrospectively, right? Like often when I'm talking to people about the rule, clients, others, it's like, well, isn't this about recalls and being able to do recalls better? And the short answer is no. It's really about allowing the agency to be able to trace products back more accurately and more quickly through the supply chain. And this is, Jim, you mentioned my background as an epidemiologist. This is kind of where I got my start in public health, was doing epidemiologic investigations and then traceback investigations. So one of the key challenges when doing a traceback investigation 20 years ago or even today is that we don't really have a structured way to carry lot code information through the supply chain. So there have been efforts, things like the Produce Traceability Initiative and the Global Dialogue on Seafood Traceability. There have been industry-led efforts to figure out how do we do this better, more consistently, and more efficiently. But we haven't really had a regulatory requirement until this rule came out back in a couple of years ago. And it was really part of the requirements that were part of FSMA when it passed back in 2011. So we went from 2011 all the way to 2022 before we really got to the point of getting some specific regulation around improving traceability. There are definitely challenges for industry in the way that this rule is structured and written. One of the key things is this idea of being able to link the traceability lot code, especially from that last segment of the supply chain, or you might think about it sort of the last mile. So once a food shows up at a food distribution warehouse or a food distributor, where does it go from there? And how do we track that at the lot code level? So when it ultimately ends up in a grocery store or in a restaurant, that we can be able to say, okay, well, we knew this lot code showed up on this day with this quantity, and therefore it was likely there when somebody ate their purchased product and became sick. So that's one of the things that I think is causing challenges, certainly in terms of compliance and implementation, because it really kind of boils down to, in a lot of instances, having to be able to trace product at the case level. And some additional challenges, certainly, there are many small operators out there that you might be a one location restaurant or a single independent grocery store. How do you capture those data, in a way that you keep the data structure the way you need to have it? There's a requirement as part of the regulation that you have to be able to report back to FDA if they ask for records, using a sortable spreadsheet, and be able to send that to FDA. So, there's questions, I think, from industry in terms of how do we do this? What does that look like? The agency said that, if the compliance date stands in terms of, being 2026, that we will, educate before we regulate. I think it's a common theme when some of these new regulations come out. So, looking at kind of that first year is going out and just sort of seeing where the traceability records are. I will say that, TAG's been involved with FDA and Levitt partners and a number of industry associations and companies to put together what's called the Partnership for Food Traceability. So this is a public-private partnership between industry and FDA to really delve into some of the technical issues around this rule and regulation. So we're working on, we've got a traceability committee, we've got a pilot committee to look at different scenarios if we're going to kind of test these systems as we build them. That work has started here in January, and we're going to continue to do that over the next year as people prepare for compliance. So I'll just give that a short plug. If that's something that could be of interest to you or your organization, you can just go Google Partnership for Food Traceability, and we've got a website. It'll pop right up. But so there's a lot going on in this space right now. And I think another call out too is that this applies to what are called FTL foods, so food traceable list foods. That includes primarily most seafood, some soft cheese, dairy products, most produce, and then things like nut butters. So it's not all foods, although there are certain certain retailers in the supply chain that are extending this traceability requirement to all foods that they receive. And so that's, created some separate issues and separate questions as well. So this also applies to, food that's grown outside of the United States. So when we look at, certainly seafood supply chains and produce supply chains, they reach into many different countries around the world. And the expectation is that this data is captured and shared compliant with the regulation if it's going to be imported into the United States. So a lot of complexity, moving parts, pieces there. And this is going to be a space we'll just kind of continue to look at and watch, over the next 12 months as we get closer to 2026. Jim, if we hit the next slide, we can talk a little bit about IAVA inspections. So FDA has started some of those inspections. They started back in August of last year, and at least as of October 2024, there have been about 10 inspections done. And we've worked with some of our clients that have had these inspections done, or that some of their suppliers have had them done. And they tend to be pretty in-depth, detailed inspections. So the way that these are working is that FDA is showing up with an inspection team that has some of the real experts in food defense inspections, and so they're kind of using it as a real-time training exercise for other FDA staff. So when that investigation or inspection team shows up, they'll issue 2 notice of inspection forms, one for kind of the normal food inspection and the other one for this food defense inspection. And the idea is that you would be evaluated on compliance for both. Now, right now, the agency is really, I think, trying to make sure that they can get full compliance on the food defense side. And so they're not really writing violations, or what we think about as a typical 483 for those. Again, just trying to get industry to understand these are the requirements. Probably the only reason that somebody would get, or the primary reason somebody would get a 483 right now, is if they don't have a food defense plan in place. That's one of the requirements of the regulation. So again, we've kind of moved beyond the educate before regulate phase right now, and FDA is doing these inspections and is looking for detailed food defense plans to be in place. I think from the inspections that have been done so far, most inspected sites are using this CAT method, vulnerability assessment method, which looks at actionable process steps and mitigation strategies, and then what are you doing to monitor and verify, and what kind of corrective action processes you have in place. So similar concept to what we would see on the food safety side, but I think where the agency has at least said that they're seeing some gaps in that approach is really kind of on the monitoring side. So how are you monitoring these critical, these actionable process steps that you've identified? Think about that kind of analogous to what we think about a preventive control or a critical control point. So you've got your monitoring piece. We're seeing that maybe there's some lack of understanding or implementation on the food defense inspection side there. And then these quick check 15-minute inspections that are part of the routine inspections that the agency does will continue, just to, again, let people know it's a requirement. Say, do you have a food defense plan in place? FYI, these inspections are starting. And so just continuing to build awareness for the agency, or sorry, for the, the regulated industry. We can jump to the next slide and talk a little bit about the Loper-Bright decision, which was decided at the end of the last Supreme Court session. I love we got the fishing boat up there. That's perfect in the background, because this case was really brought about by a fishing industry that was challenging one of the federal agencies against charging fees to have inspectors on fishing vessels. And so what it really came down to is, back in the 80s, the Supreme Court had decided the Chevron case and basically said, if legislative language is ambiguous, that the federal agency in the process of rulemaking, can fill in or sort of color in some of the ambiguous space in whatever Congress passed. And so this decision overturned essentially that portion of it. So now courts no longer defer to federal agency interpretation if there's ambiguity in the statute. And what it says is that judges now have to think about sort of the single best meaning of statutory text independently. So when we think about a lot of the food regulations that we've seen, certainly with FSMA, if you've printed off FSMA, tucked it under your pillow at night, sleep with it, they're just hoping for osmosis and memorization. That's a good thing. But I think what you'll see is that, there's a lot of specificity in a lot of the FSMA language, and that specificity carries over into the regulations that have come out of it. I would say that, Jim, you mentioned at the top of the the presentation, I've worked on drafting statutory and legislative language, from the executive branch side when I was in Minnesota overseeing the inspection program there. And, you're trying always to balance this, not be too prescriptive in the law that you're writing, but really create a structure or a framework that allows the executive branch to then go carry out the will of the legislative branch. And I think FSMA really was written in a way that it struck a good balance between those two things. I mean, it took a very process-based approach to hazard identification and risk management, and that certainly showed up in the regulations. So, when we look at applying that lens to a lot of the FDA regulations, at least in my opinion, there isn't a high level of ambiguity. Now, that's not to say that somebody out there might disagree or read a rule or regulation and feel like what the agency came up with isn't actually supported by what FSMA ultimately said. And that's been a question, I think, around the FSMA 204 side of the equation, is that, is this going to stand? This is a big impact to the industry. Are we going to see changes? I think when you look at the core text of FSMA, it charged the agency with defining better traceability systems for what FSMA called high-risk foods. Now, FDA kind of said, well, we're not going to call them high risk because it has a negative connotation. We're going to call them FTL foods. And so they applied a whole risk ranking model rubric to identify what's an FTL food and what isn't. And, you can probably debate around the finer points of what ended up on the list and what didn't, but it really is an execution of what was in the FSMA text to begin with, or at least that's my take on it, at least at this point. So, I think the impact on the food safety side, therefore, may not be terribly significant, although, we never know until somebody looks at something and says, yeah, I want to challenge this regulation based on this new interpretation. So at the end of the day, I don't know that in the short term, we're going to see a lot of changes, but I do think that as Congress considers future legislation, that there'll be a drive to more specificity and less ambiguity in terms of this is what we're thinking, especially if an agency is going to go out and write a rule or regulation based on that. So that's a quick kind of thumbnail overview of that. I think we can jump to the next slide. So what are some predictions from 2020 or for 2025? I was searching around for my crystal ball, couldn't find it. And even if I could, I'm not sure it would work too well right now, because I think we've seen, certainly with the new administration coming into office, that there's been a lot of change in a short period of time, and probably a lot of it somewhat unpredictable. So at least in terms of kind of what the common thinking was prior to this month, and I think carrying forward, when we look at what FDA is considering, and HHS overall, obviously RFK's nomination hearings were Wednesday and yesterday. A lot of the topics didn't get talked about necessarily in terms of like ultra processed foods or things like that. Food additives and ultra processed foods, that's something that Robert F. Kennedy Jr. has been passionate about. That didn't really come up a lot in his confirmation hearings over the last couple of days. A lot of it was focused on vaccine safety and some of his comments around that, which we're not going to cover in terms of this food safety discussion. So, there's no time frame. And I haven't checked the news yet this morning, or since we jumped on the FSMA call here, but at least as of this morning, the last time I looked, there's no time frame set to vote on moving his nomination forward to the full Senate. So, but if we were to see that, I think we would likely see a greater focus on food additives and ultra processed foods. And we saw earlier this month that FDA declared red dye number 3 no longer safe for use in human food, and created a compliance time frame for that, which I don't have memorized right off the top of my head. So likely to see more in that space. I think we also could see a reevaluation of the GRAS process. So this is the process by which companies determine if a new ingredient or a food additive is generally recognized as safe. So there's been criticism of that process because as of today, a company can convene its own internal GRAS panel, do the work, make a safety determination based on that work, but they don't have to inform FDA of that finding. They have to have gone through the process and be able to justify using something as a new food additive. But it used to be in the late 90s that there was a sort of a positive, or sort of a requirement, I should say, in terms of submitting that information to FDA for approval of a new ingredient or additive. So that went away, but there may be some interest in bringing some things like that back. And I think that ties into just probably an increased likelihood of oversight of dietary supplements as well. So certainly we've seen some issues with dietary supplements in terms of food safety, but also just in terms of claims that get made around some of these products in terms of being able to cure certain diseases, things like that. And so I think we're likely to see more of a regulatory interest potentially in terms of how those products are both marketed and also some of those ingredients evaluated that can be included in those products. And then, this comes up fairly frequently, but given just some of the positions we've seen the new administration take in terms of being willing to think about ways that the federal government is structured or kind of disrupt the way that the current federal government agencies are put together, we may see a revisiting of creating a single food safety agency. This is something that I think often comes up given the fact that we've got two primary food safety agencies, but many other agencies that are also involved in things like labeling and other issues like that. So that's something, as time progresses, that we may see get picked up. Next slide. I think we can jump to the next one. So some things to watch for, or the things that I'm sort of thinking about to watch for. One is HPAI, and I know we've kind of been thinking and talking about this since last spring, especially when we first discovered just about this time last year that dairy herds were starting to show up and with some symptoms, affecting milk production, and that traced back to those cows being infected with H5N1. That's only really continued, and I think one of the maybe concerning findings that has come out more recently is that there's good indication that herds can be reinfected. So there were some herds in Idaho, for example, that had been infected this spring and then reinfected this fall with likely through a new exposure to whatever wild bird sources they're coming into contact with. So the broad concern around that is that it suggests that there's this potential for H5N1 to become endemic in our dairy cattle populations. And really, when we think about where a lot of the transmission has happened, it's been in those types of settings. So either poultry processing or poultry growing facilities, or more in kind of dairy cattle settings. So many of the human cases we've seen have those types of exposures. And I think the chessboard is set in a way that we don't have evidence that this is happening right now, but if we saw more severe infections, and there's been a handful of severe infections in humans associated with H5N1, one in British Columbia, another one in the state of Louisiana. But if we were to see the virus mutate because of its circulation, let's say in the dairy cattle population, to the point where you would actually get person-to-person transmission, then I think that we're in a spot of significant concern. When we think about, 5 years ago, just right about this time, we were contending with the COVID pandemic. HPAI has typically a much higher mortality rate in humans than COVID did. So, you could be as high as 20% or higher. And so that's not a space that we want to be in. So when we look at the public health surveillance systems that we have in place and just the potential for impact, I think this is an area that we want to continue to watch and pay attention to. It's not likely to go away in the short term. So if we click to the next slide, what are some other things to kind of watch? I think changes in the federal workforce. Obviously, this new administration has talked about requiring employees to come back to the office full time and to make that decision by, basically within a week, by the end of next week. And, what does that mean in terms of potential workforce reductions? From a public health standpoint, obviously there's a lot of folks that work in the public health space that have chosen to kind of spend their careers working for the federal government and kind of being in a mission-driven capacity, working for agencies like CDC or FDA. Certainly I've had the privilege of getting to know a lot of those people over the years, both in my work in state government and also just working now on the consulting side of the world. Our food inspectors that are out there from an FDA standpoint, they're out there doing the work that we've been talking about. So, if we see a reduction in that workforce, there's the potential that does sort of have knock-on effects in terms of just food safety overall and some of the public health concerns that we've been talking about. We've also seen, just the use or a much more prevalent use of executive orders coming out of this administration to begin with. So one, we've got a regulatory freeze right now on any new regulations, and certainly those would apply to things that could cover food safety as well. And then, I think we saw earlier this week, a memo go out that temporarily just restricted the use of federal grant funds and then was rescinded. But I think, we're seeing an administration that's just trying to discover the extent that it can use executive orders to really drive policy at a federal level, and we could probably have a whole separate conversation on separation of powers and between the legislature and the executive branch. But suffice to say, it creates uncertainty in a lot of these spaces, certainly in the short term. And so I think we've seen, the agencies trying to respond to that. And that's why I think trying to predict anything in the short term is going to be a little bit of a challenge. So we're going to have to see where some of these things shake out as the next couple months roll out. But I think that's the end of my slides, Jim, if we want to stop.
It is. Yes, indeed. Yes, indeed. And, like you said, this is early stages. We have a lot of questions still on FSMA 204, which has been talked about for quite some time now, even after it has been finalized. And actually, that's a good segue into a lot of the questions that have started coming in as I'm watching the chat, the question pane. Really, you had kind of called this out though before. When it comes to FSMA 204 or traceability compliance, how exactly is it that foreign suppliers will be complying to this? I think this goes back to, again, making sure that you have the right data that the FDA or the auditor is going to need in order to say, yes, okay, we know that we can trace this back all the way to the lot.
Yeah, absolutely. And it's a good question. So I didn't get into all the details, but when we think about the way that regulation is structured, you kind of have critical tracking events, right? That's the time and the place where you're collecting key data elements. And it starts with harvest, right? So when we think about things like, fruits and vegetables that are covered under the rules, FTL foods, you have a harvest critical tracking event where you have to capture some of those. Well, you have to capture a specific set of key data elements, and that can be all the way to the farm level, in a variety of different countries. So, if you're an aquaculture shrimp farmer in Thailand, or if you're, growing cantaloupes in Central America, those are the types of data that are required to be collected and then passed forward in the supply chain. And so, again, I think there's varying levels of awareness and sort of visibility into that. And then the rule applies to those who physically handle the products. So there's some
Mm,
complexity there too, because you obviously have people that work as importers or brokers that don't physically handle the product, but that capture a lot of the information that would be considered, key data elements. And so
right.
it really comes down to making sure that you've got the right data and that data is getting exchanged at the right points in the supply chain. So even those that might not need to officially comply with the rule need to have some awareness and really kind of think help their supply chain partners figure out, okay, here's what I need to do at this particular step or point in time.
Yeah, and I know we've talked about on other webinars and other broader discussions, but overall, how is it possible? I think somebody actually asked the question here before, when you brought up a sortable spreadsheet, is that required? So it comes down to this, and you again raised this earlier. As a small or mid-sized business, as part of one of the links within the food supply chain, maybe you don't have the infrastructure or the technology to get all of that data, put it into a sortable spreadsheet, and obviously send it out. What kind of advice would you give to folks who are maybe doing some manual, like paper pen kind of stuff to capture some of those data sets?
Yeah, one, you can, FDA is actually, put on its website. So if you just Google, FDA traceability rule, you can go to their website. There's an FAQ there, and they have an example of what they, would accept as a sortable spreadsheet. So, if people have some familiarity with kind of basic spreadsheet software, you could go and look at that. I think the important thing to acknowledge there is that you don't have to trace all your products that way. You could certainly use pen and paper. It's just that if you're ever asked to provide that information, FDA is essentially requiring that it be provided in that format of a sortable spreadsheet. So you could take your paper records and you've got 24 hours to provide that information. So if they came, to your small farm and said, hey, just over the last 2 weeks or within this 2 week period, how many melons did you sell and what were the,
Right.
what's the information for that? You could retrospectively enter that into the spreadsheet and provide it to them. So it's not like you have to have an electronic solution all the time. Obviously, it would make it simpler to meet that request, but
Yeah. Yeah.
yeah.
Um, let's move on to the intentional adulteration. So, question came up around, will there be inspections for importers, or is it just for manufacturers?
So the regulation applies to anybody that's, again, moving or selling food for sale or importing food into the US. So there's a food manufacturing facility outside the US, much like all the other regulations that fall under FSMA, that intentional adulteration inspection applies to them. It's not been the primary focus of the agency at this
Right.
point, but there is an expectation for compliance.
Yeah. You had mentioned the CAT VA or CAT VA method has some gaps, particularly around monitoring for those that had already been inspected. Can you give a little more detail around monitoring? What does that mean exactly?
Yeah, and I will admit that I've got colleagues that are more versed in this area than I am. So, if people want more of a detailed response around that, we can follow up by email too. But, when you think about, let's say, mixing as a key activity type, where you're going to say, okay, I've identified that as a potential area of risk, right? You've got an open bulk mixing portion of your operation, and you know the rule requires you to think about what are mitigation strategies for managing that. Because let's say you've got one worker working in that space. Well, the rule would say a way to approach that is to have two workers in that space. Then the question is, how do I monitor the fact that I had two people there all the time at that bulk mixing step so that there wasn't a risk of introduction of, you know, unintentional, like material that could cause injury, whatever that is, that's intentionally added to that point in the process. And so it's thinking about, how do I create the record that the mitigation steps that I've defined are effective? That's an example. Hopefully that
Mhm.
contextualizes the question.
Yeah, I think so. And when it comes back down to the intentional adulteration rule, is this are there any exceptions, like if you're a small business or something, or is it basically anybody that, again, is part of the food supply chain has to have a food defense plan?
There are like for just about every FSMA related rule or regulation has an exemption. I don't have them memorized off the top of my head, so I invite people to just go again, like Google or do a web search around IAVA rule, FDA, and they've got a pretty good, what I think they call at a glance documents that you can find on their website that really lay out in specificity who's exempt.
That's fair. And this one is interesting. Alex asks, any thoughts on front of pack labeling rule, which was submitted on the 16th of this year?
Yeah, that's a good one. I mean, I think that's another sort of crystal ball question. I look at interest within the new administration around some of those issues. Again, we brought up kind of ultra processed foods, or we've heard kind of this "Make America Healthy Again." A rule like that would be more in line, I think, with that type of priority. So, are we likely to see a rule like that move forward where we might see others not? I think it's early days.
Just early days, yeah.
It's a good question.
Yeah, follow-up from Melinda is, will it apply to oh, my screen just moved. Will it apply to no retail food produced in bulk for the industry?
In regards, which reg do you think we're talking about?
The front of label packaging rule.
Oh, no retail food produced in bulk. I have not read that rule. I would imagine that there's probably, an exemption or an option for labeling in that kind of setting. Because if you think about bulk food today, right, there's still an expectation for labeling. It just doesn't have to be on the bulk food container. It just has to be available to the consumer. So
Right.
I will say I have not read that reg in great detail. It's a good question, but I imagine it's addressed in some way.
Yeah. Now, let's go back to FSMA 204 because, again, this is something that's been around for a while. There's a lot of information from the FDA and other resources, including the Partnership for Food Traceability. Little plug there for the tag team. When you are speaking with food manufacturers, where is everybody's head right now as this deadline is looming? So talk to me from the standpoint of, say, I don't know, a FSQA manager versus an executive. Where's everybody's head at in terms of getting prepared?
Yeah, I think, from a manufacturing standpoint, the industry's really matured over the last 15 years or so, especially when I started kind of doing these investigations 15, 20 years ago. A lot of the kind of ERP and where, kind of SAP systems in terms of inputs and outputs from a finished product standpoint have really matured. So maintaining traceability out throughout the manufacturing process from a raw material or raw ingredient to a finished product standpoint, that's pretty commonplace now. So maintaining traceability as part of the manufacturing process, I think, is not the barrier. It's when we apply that traceability lot code to the finished product case that then gets shipped to warehouse for distribution. Right now, kind of tracking that at the case level, especially when the warehouse or distributor gets it, that's really where we're seeing the breakdown. So not to say that, every manufacturing process meets that requirement today, but there's less friction there than down at the other end of the supply chain.
Okay, that makes sense. Now, with regarding some of this, again, we don't have an actual crystal ball. We don't know what will happen, but you had brought up a few potentials, such as more scrutiny over food additives, or perhaps this new food safety agency. Knowing the history of government and how fast it actually moves, what's the likelihood that we will see actual change in 2025?
Oh, that's a good question. Actual change in 2025?
For those of you who may have missed this, we are in January. Things are just kicking off.
That is true.
Yeah.
I don't think, I think we may see the table set for some of these bigger changes, but I don't think we're actually going to get there in 2025.
Yeah,
Federal government's 2 million people, and there's a lot of complexity out there. And I think, even trying to move fast and break things, it's hard to turn a ship that big that quickly. But we'll see.
exactly.
I could be wrong.
Well, exactly. It'll be interesting for sure. Alex just posted this. I like this here. Uh, he would like to better understand the draft guidance around management of sanitation in low moisture foods, specifically around applying a sanitation treatment when remediating after a pathogen event.
Ooh, that's a great question. And in fact, one that just came up this morning on our
Oh,
internal tag team call. Um, yeah, it's a good question. I think, validating the efficacy of some of those, sanitation processes, especially in closed systems, where you're dealing with low moisture foods. Uh, we're in a space of sort of emerging science and technology and needing to think about, like, what does that actually look like? I'm not answering your question probably terribly specifically, but if you've got more specifics around kind of what you're thinking about, Alex, in terms of, particular application, maybe send an email as a follow up. We could dig into that some more. But it's a good question, and one that I don't, depending on the scenario, may or may not have a clear answer.
also, in the thread of not maybe having a clear answer, what is your interpretation? Will the FDA create a UPF or ultra processed foods definition? And if so, what would be the estimated timeline for that?
Yeah, that's another good question, and one you have to, right, if you're going to take some regulatory position in terms of, regulating something, you would need to come up with a definition. And, the question would be, would the administration try to go that route through executive order? That would be a lot
Mhm.
faster. Or do you try to go that route through a traditional rulemaking process? I mean, I think from a durability standpoint, the rulemaking process would be more the way that the agency would want to go. But
Right.
again, I think we're sort of in a space of uncertainty right now in terms of regulatory approach.
Right. Yeah, that kind of leads us back to the Loper Bright decision and how, as you said, there's really not going to be any short-term changes, but in the spirit of, to drive more specificity around what these terms and guidance actually means. That's even ambiguous in its own right, where we don't exactly know how that's going to play out.
Yeah, that's true, right? How specific is specific enough,
Right.
or does do you see legislation essentially taking on the form of regulation? Around some topics that may work. I mean, certainly some regulations define limits, right? In terms of you're allowed to do X amount of Y, but
Yep.
when we look at more traditionally, I think, Congress is left defining those especially scientific and technical limits up to the agencies, because, as science changes or gets better, obviously, the level that we want to regulate to may change as well. So, um, but yeah, these are all great questions. I guess.
Um, one more broad brush question here, and it is around supply chain stability. So, we asked some questions earlier about foreign suppliers, that sort of thing, and it's always kind of hard sometimes to manage supplier compliance. Do you have any insights around best practices? How do you ensure that your suppliers are going to not just provide the ingredients that you need or whatever it is that they're giving you, but also be within compliance? Are there any tips, tricks to make sure that they are giving you the data that you need in a timely way?
Yeah, I know. I think some of it's making sure, obviously, that you've got one, that you've done, your hazard analysis. So if you're asking a supplier to control a hazard on your behalf, that you've done that well, and that you've defined that well in terms of expectations in your contract with that supplier. I think the other piece is doing that supplier risk assessment, right? So
Mm,
do I have one supplier in a key area, or does this company give me 90% of my ingredient, and it's really important to my operation? So it's prioritizing. There's obviously always going to be limited time and resources, so it's prioritizing who you evaluate first. And I think other strategies can certainly involve, reaching out to entities. No plug here, but entities like TAG that can help do those assessments, or finding entities, especially in those countries, that can help you do those assessments. But I think it's important to be really specific in terms of what you're looking at in terms of those programs, especially if somebody is controlling a hazard on your behalf. You want to make sure that they have a well-written food safety plan in place, and that they're obviously doing what they say they're going to do, which sometimes can be difficult to evaluate, especially internationally. Appreciate the complexity in that question.
Yeah, and again, on the best practice thread, is there any guidance that you would give based on all of the conversations that you have with those that process and manufacture food and beverages? Where's the biggest challenge when it comes to maintaining a food safety plan, keeping it up to date, making sure that you have your corrective prevention actions in, all up to date, and that if should anything occur, you're ready to take action and remediate?
I think this is a good question. For me, I think it's in where people have identified something as a preventive control. It's making sure that they've done the work to really validate that control works.
Yes.
It's one thing to identify the problem. It's another thing to know that your solution actually solves for it. So, that's where I more and more encourage people to spend their time. We've established this as a critical limit. Okay, but how do you monitor that? Are you actually doing what you say you're doing, or does your process actually allow you to accurately assess, the critical limit that you've defined? Where more and more where I see breakdowns, it's in the validation and then the execution of the verification of those preventive controls.
It's a good point. I remember having a webinar where there was kind of a clarity around the difference between verification and validation. There's still some ambiguity on that.
Yeah, right, and that's right. Just getting familiar with. So validation is, how do I prove the process that I have in place works scientifically? And then verification is, then how do I continually check the limits that were defined by the validation process to ensure that it is working? So.
Yes, indeed. All right. Looks like we have gone through our questions. So I appreciate everybody who reached out and had some dialogue with us. It was fun. Ben, thank you so much. We really, we really did learn a lot, even though, again, it's early stages, us being in January right now. We have a very exciting year ahead, I'm sure. If you have questions, of course, the Acheson Group is here to help. You can go to their website, achesongroup.com. And again, another plug, please do check out their partnership for food traceability. This is a collaborative effort to make sure that everybody has the right information, timely information, so that we can make quick actions. Also, if you have any interest in checking out our library of food safety related guidance and e-guides, we have them over at safetychain.com. Head on over to our resources section, and we'd be happy to share any of our stories with you. Now, again, this is a monthly webinar series, so please do keep a lookout for the next FSMA Friday. Ben, we love you. We'd love to have you back on. And again, Happy New Year to you, sir.
Yeah, likewise. Appreciate everybody's time today. Have a good weekend. Thanks all.
Take care.